When someone new sits next to you, please introduce yourself. Let's all walk out of here as friends. We walked in as strangers. Let's all walk out of here as friends. So if you don't know the person next to you, just shake their hand and just say where you're from. All right? I see there's a lot of empty seats. Is everyone sitting down? Raise your hand if you have. We're LinkedIn friends, right? All right, great. Yeah. Is everyone sitting? Yeah, yeah. Sit down, please. Does anyone else want to sit? These gentlemen have seats next to them over here in the middle where you can't sneak out. All right, all right. Let's simmer down, simmer down. Really quickly, someone give me a highlight from Dr. Bill. What did Dr. Bill say? Yes. He's much more handsome than he's photographed. There's the takeaway. All right, everyone. Let's. If we could quiet down, everybody. If we could close that door in the back too, that would be great. If somebody could close that door. All right. It's my honor to bring up my Iranian sister, the Chief Medical Director of True Binding, Dr. Arbella Sarkis.
That's a pretty cool name. Yeah. And it's thrown bio, and I can give you his contact information and make that connection. And then because what we've seen
So,
results with.
all right, wonderful, great, 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 great. This one, okay. Oops. All right, this one.
No,
No, that's all right. Okay. Well, thank you very much for coming in. Um, Today, I want to talk about a new way of looking at anti-aging. And one of them is galactin 3 protein. How many of you are familiar with galactin 3? Wonderful. It's one of the newest. I didn't know about it until 3 years ago. And as I learned more and more, I saw that how much galactin 3 is important in our daily life. And of course, as a anti-aging, is a very important protein to focus on it and make sure that we are looking and to learn more about what the galactin 3 can do and cannot do. Galactin 3 actually is a protein that we produce in our body. We can find it in serum and in the urine. It's very important because galactin 3 has multiple function. I don't know why it's not working. So,
okay. So,
oh, okay. Okay, right there. All right. So, galactin 3 is a protein that is available in our body, and we all have it. And it's very important as a function, as a protein, because it regulates intracellular, extracellular cell function. By saying that, it's very important to do repairs in where we have infection or where we have damage of the cells and proliferation. So it controls basically cell to matrix function of cell. Imagine galactin 3 as being a firefighter versus a arsonist. So in good way can do a lot of good to us, including apoptosis, as you see here, and which is the death of cells. Of course, when that is dysregulated and not working properly, producing too much of it, it can even turn to cancer. So galactin 3 basically is something that we will see it in every level in our body from head to toe, but mainly today's talk is about brain. So galactin 3 also works on lysosomes. Lysosomes are enzymes in the cells that basically clean up. They are garbage cleaner. And when this regulation of galactin 3 happens in our body, and if you say why, how, unfortunately is related to our environment, our diet, our plastic, and all the chemicals that every day we are exposed to and damaging lysosome function. All these toxins, they remains in our body and day after day damages the cells. The most important thing, of course, to me, definitely as a physician, I am looking at all our organs from head to toe, but brain is the one. If I have a good healthy kidney, liver, everything healthy, but if my brain doesn't work, what is good about? Unfortunately, I'm sure you heard these days we are getting a lot of patients that they've been diagnosed with the frontal temporal dementia. There's no treatment for it, but this new medication came in the market, not in the market yet, is under investigation. All is a humanized monoclonal anti-galactin 3 that it can reverse dementia. And with that, it affects many other diseases in our body as we go through. The one of the most important, as Dr. Speaker before me spoke to, is about heart. And that one I saw it really with all my patients. Everything that you see in these different um, uh, slides, each one of them really I experience with my patient. And as you see, at the level of heart causes a lot of issues with atherosclerosis, changes with heart failure and dysfunction of the heart, as well as kidney. How many people these days we are seeing that at a very young age they are coming up with the kidney issues, they end up with the dialysis. Of course, that's one way to prevent. Medication that TB006 was approved in June of 2023 by FDA for compassionate use for those patients that they have diagnosis of dementia, all kind of dementia, from Alzheimer dementia to Parkinson-related, Lewy body, Hodgkin disease, vascular dementia, any kind of dementia. That's the only medication, very safe, that works very well at the level of brain and all other tissues, working as anti-inflammatory. We know that most of the disease, including cancer, is an end stage of chronic inflammation, and inflammation comes from exposure to chemicals, etc., etc. Another way that galactin 3, unfortunately, when it's upregulated, damages our body is the angiogenesis. Angiogenesis is very important to repair wound, to repair damaged organ, but sometimes when it's again upregulated, causes cancer. Cancer cells, tumors, they need new circulation to feed themselves, to grow faster. And unfortunately, when again we have too much galactin 3 in our body, we are prone to get cancer. Fibrosis is very important for tissue repair. When we cut ourselves or any damage to anywhere in our body, fibrosis comes and repairs cells and repairs the organ. But again, if it's produced too much, causes damage to the liver with cirrhosis, kidney with end stage renal disease, and etc., etc. And the last one, and not least, is the antimicrobial activity. To some extent, it helps with regulation of bacteria and fungi. But when is again upregulated, promotes the function of the growing these fungus, which we know in cancer. Cancer loves fungus, and that's another problem. As we go down to this last slide, cancer progression, we know that cancer has its own capsule. So galactin 3, unfortunately, causes this uh, unveiling the capsule and make the growth of the cancer much faster. Using TB006, that obviously is presently approved only for dementia, but we saw that how it's going to work at the level of cancers. I had patient that honestly I didn't know anything about his cancer. He had multiple myeloma. He was my third patient in September of 2023. I treated him for dementia, and he came back and he said, Dr. Sarkis, something new happened to me. And I said, oh my God, may I did a boo-boo here. Sometimes it's gonna, something happens with the new medication. In good faith, you try to use that for patients. He said, no, my markers for cancer went down 50%. Stanford changed 3 times his chemo. Nothing was working for him. And with that, of course, I knew that this is going to work also as an anti-cancer. So feel free to use it for those providers, MDs, DOs, and nurse practitioners in other states that have license to use it, that even patient with cancer, you are going to do well to them. You are doing a favor. It's going to work. Their chemo will work better because you are getting rid of all these new circulation, new vessels that they produce, as well as all these fungus and all the bacteria that they start having. Those, it will help them to recover faster beside their memory. Um, excuse me?
What's the name of the monoclonal antibody?
TB006 presently does not have any name because we are still under investigation. All we are in phase 2A and going for phase 2B. The beauty of this medication is that right now we have 2 more studies going for exclusively for Parkinson disease as well as autistic people, because we are doing with 18 years older to up to 35 years old. Treatment is beautiful.
Would you recommend it for somebody who's dying of multiple myeloma?
Well, I will tell you at the end of this speech. Right now, medication is approved by FDA for dementia. But in Bahamas and Honduras, we have 2 clinics that we are sending all our patients. Right now, I have a 54-year-old pancreatic end stage cancer, and I want to send him to Bahamas. Let's see which one they would like to go just to get to treatment. In America, we have no, not that indication, but yes, you can do everything in these 2 countries. We have clinic over there, and they are wonderful, and they do everything. But we send patients to be treated. There's no control of. Definitely, yes, please do so. Again, with the chemo, as I said, that patient of mine, I didn't know, and he came back and said, well, it improved my markers. Immune response. We know that cancer is caused by immune diseases, autoimmune disease, starting from the guts, leaky guts. All of you guys, you know that. But again, with using TB006, it will help also with our immune system and immune diseases. I had patient that she came from Oregon. She had issue with the asthma. After 3 treatment, I didn't know again what I was dealing with because I was treating her for dementia. She came back and she was on the maximum dose of the inhaler called Flovent, 220 milligram, 2 puffs a day, 2 puffs twice a day. She ended up to do 1 puff at half of the dose, 110 milligram. It was amazing. Another issue that we get with improvement with this treatment is the guts. This lady, she could not tolerate 5 food, only 5 different food for years. Otherwise, she would get cramps, abdominal pain. After, I think, third or fourth treatment, when they came back to office to get the treatment, her sister told me, you know what happened? Lynn now is able to eat McDonald's food. And I said, oh God, she survived. And of course, French fries. And that was really amazing. I did not expected none of that. These were not written by then. But as time passed by, we are learning more and more about galectin 3, how could be good and how could be bad. Good news is we have a wonderful drug that has very, very high profile of safety. And I did more than 130 treatment and more than 20 patients. None of them had really no issue with any kind of bleeding side effect that I had to stop the medication. Again, we go back to immune system remodeling and all of that, that as I explained, the patient of mine what did. And this is the best way to treat as a anti-aging for all our patients, and one fits all from head to toe. You do the treatment with pulmonary fibrosis that there are disparate, you can get the best treatment. I have a short video for you guys, please. Thank you. Oh, really? Oh, yeah. No? Okay. I had also Yeah. Okay. I have also, I had a case presentation of one of our patient in New York. This patient is a professional football player. Unfortunately, he had multiple brain injury. And in one, there you go, this gentleman. And he was homebound, not verbal. He had hypoxia in one of his, oh, great. All right. Let's see, please. What's this?
And robs people of their memory, as well as other cognitive abilities
Miracle.
that are required for daily living. It leads to the most common form of dementia and is characterized by two hallmarks. One, abnormal clumping of amyloid beta, A beta proteins into toxic plaques. And two, abnormal clumping of tau proteins into destructive tangles. In addition to these plaques and tangles, there is another protein involved called galectin-3, GAL3, which is found at abnormally high levels in the brains of Alzheimer's disease patients. GAL3 binds to A beta and acts as glue, causing A beta to bind itself and form toxic plaques. Additionally, GAL3 binds to defective tau proteins and causes the tau proteins to clump up into toxic tangles. The disassembling of
I will go with a quick testimonial and I'm done. Can you please go with the second one? No, this gentleman. Ah,
I'm already at the stage where I can run cars, drive around, and that was a big one. And it allows you to do trips, not a long way, but a little way. Go to the grocery store, come back home, that kind of thing, and it just makes it like, okay, you're a real man, you're a real guy. You can do whatever you want to do.
thank you. Thank you very much. I'm really excited about this medication. I've been in practice for 30 years. Nothing as rewarding like this treatment for our loved one. And God forbid, if we need it, there is a hope for all of us. Thank you for your attention. Thank you.
Thank you.
Thank